I was the first person in either side of my family to go to college, and so didn't have any mentors in the medical field, but I just loved anatomy and science and things like that. So I decided I was going to be a doctor. And while I was at Drake University playing basketball, many of the other athletes that I was around were football players who had shoulder and knee surgeries, and I was very intrigued, but looking at them and seeing the scars and knowing that they had ligaments and bones that needed to be healed, and so I decided at that point that I wanted to be an orthopedic surgeon, and that I wanted to be a team physician and take care of the athletes, and that's what happened when I came to Bellingham. Dr. Heaps, who was also one of the people I joined, he had been the Western Washington University team orthopedist. And so when I came, he said, "Hey, how would you like to share this?" And I said, "You bet." And so that was a dream come true, and we shared it for a year, and then he gave it to me. So I've been doing this now 28 years. My specialties within orthopedics would be primarily knee and shoulder. I'm really truly considered a general orthopedic surgeon in a community this size. When I came here, it wasn't very common that you would just do one thing, like in bigger towns like Seattle. I love taking care of people, and that doesn't always mean surgery. I'm very conservative, and I would give them all the options, both surgical and non-surgical. I also don't run a mill. I really like to spend time with the patients, get to know them personally. We have a great time here. Most of the time, if I'm not running behind and kind of hectic, I really enjoy the time that I get to spend with patients in the office. And I think it's vitally important that you listen to the patient, because they will tell you what's wrong with them. They may not know what's wrong with them, but as they talk, they're giving me all kinds of clues as to what the diagnosis is. And so if you take a very thorough history and examine them thoroughly, get any imaging studies that you may need. I'm a frugal Norwegian. I try not to just order MRI scans and CAT scans and things like that unnecessarily. I think a good history and physical exam frequently will give me the diagnosis. And then I will thoughtfully lay out a plan for them to choose, a menu to choose what they would like to do. And then also, by operating at the surgery center instead of a hospital, the cost of care is greatly reduced, and I do all my surgery at the surgery center. Knee and shoulder surgery comprises about 80% of what I do, but the other 10 to 20% would be hand surgery and foot surgery. Do outpatient joint replacements is one thing I started 10 years ago this month. In May of 2006, I became an outpatient surgeon, left my hospital practice when I used to do a lot of joint replacements. And we had a surgery center, and I developed an outpatient joint replacement program there so that patients can come in who are younger and healthier and have their hip, knee, or shoulder replaced and stay overnight and go home the next day. Some partial knee replacements that I do, they actually go home the same day. So that's kind of revolutionary. It's a trend that's growing across the country, and I was the first one to do that in the state of Washington, and for many years we were the only center. The Pacific Rim Outpatient Surgery Center was the only center in the state doing that. So we're having our 10th anniversary here this month. I love to listen to the patient's story and get to know them as a person first. I don't like to come in and just start focusing on their knee or their shoulder. I want to know who this person is a little bit. And as I said earlier, if you listen carefully to the patient, they're going to tell you how it was injured, and from that story you can decide what structure may have been injured. They're also going to tell you symptoms-wise, how big a deal is this? What kind of symptoms are you having? Is it looseness? Is it weakness? Locking, catching, so that you can decide what anatomical structure might be the problem. So I think it's vitally important to talk and listen. You know, God gave us one mouth and two ears, therefore we should listen more than we talk.